Hello, my name is Leah Austin, and I'm going to be speaking to you guys about Tourette's syndrome. Tourette's syndrome is a neurological disorder characterized by repetitive, stereotyped, involuntary movements and vocalizations that are known as tics. The disorder is named after Dr. Georges Gilles de la Tourette, the pioneering French neurologist who in 1885 first described the condition in an 86-year-old French noblewoman. Tourette syndrome is also referred to as TS, which you'll hear a lot, or tics. Generally, ages between 3 and 9 children are diagnosed. Men are 3 to 4 times more likely to be affected compared to women. About 200,000 of the Americans who are diagnosed have extreme Tourette syndrome, and about 1 in 100 Americans have mild Tourette syndrome. When I was 5, I myself was diagnosed with Tourette's, and I'll be sharing a little bit of my story while explaining Tourette syndrome. I'll also not only describe a little bit more, but also the symptoms and any cures or preventative actions that come with Tourette syndrome. So, how Tourette syndrome is diagnosed. Doctors usually keep a track of repetitive motor and vocal tics for 1 year. Many doctors will tend to wait several years before making a diagnosis in order to make sure that they're not going, like the kid isn't going through a phase, or that those repetitions aren't leading to some other diagnosis. So although Tourette syndrome can be a chronic condition with symptoms lasting a lifetime, most people with the condition experience their worst tic symptoms in their early teens, with improvement occurring in the late teens and continue into adulthood. Symptoms of Tourette syndrome include both motor and vocal. There's also simple and complex. So as far as simple motor symptoms, that would include eye blinking, shoulder shrugging, neck stretching, things like that. And for vocal would be things like sniffling, throat clearing, grunting, shouting. I personally have had more of the simple tics, so things like eye blinking, neck stretching, and throat clearing. As far as the complex motor and vocal tics, motor-wise, it would be hopping, twirling, jumping. It tends to involve multiple muscle groups. In my own case, I actually would softball pitch as my complex motor tic. I didn't really have complex vocal ones. The vocal ones would be words or phrases that occur out of text. Likely to be inappropriate words like swear words is what people probably think of when they think of Tourette's. Tics can be worsened with excitement or anxiety. I grew up with anxiety, so my tics would be worsened. And also, with having Tourette's, people tend to also have conditions that include ADHD, ADD, impulsivity, and even obsessive compulsive disorder, so OCD. As far as treatments for Tourette syndrome, there's no cure, but there are ways to go about it. Conditions tend to improve in the late teens and early 20s, at least for more individuals at least. As for myself, I still have TS, but it has mild down a lot more. Historically, medication has been used to help treat people with Tourette's, but it does come with a lot of side effects, so people try to stay away from that. The Tourette Association of America says that there is a kind of new way to approach Tourette's, and that's through comprehensive behavioral intervention for tics. So essentially, it's kind of like behavioral therapy, and it helps reduce the severity of tics. It's essentially training to voluntarily move in response to a premonitory urge that can reduce the symptoms. So in conclusion, Tourette syndrome is not a life-threatening disease, and it is an illness that many people have to learn to overcome and deal with. I personally do not let my Tourette's define me. It is a part of my life, but I don't let it rule me. As we see in Genesis 1:26, when God creates man and woman, he says they are good. We are made in the image of God, so we are perfect, and Tourette's should not change how someone is viewed. Tourette's is viewed negatively in the news. Many people with Tourette's, though, are not diagnosed as severe, and that's why I wanted to share this with you guys, that most likely it's mild things that you wouldn't even notice. Tourette's can be hard to diagnose initially, but it becomes more clear over time. Also, just to review, TS can also be both motor and vocal, along with being simple and complex. And once again, Tourette syndrome is not curable, but there are ways to cope and manage, whether that's through medication, the behavioral therapy, or simply just time. Thank you.